The Region 5 health officer is urging residents to adhere to certain measures to prevent the spread of COVID-19. More in this report. The coronavirus continues to spread in our country and around the world since members of the public disregard the advisories sent out by the health officials of the ministry and the World Health Organization. However, in Region 5, the health department continues with its efforts to prevent the spread of this disease among its residents. Regional Health Officer Dr. Desmond Nicholson shared these precautionary measures that he hopes all residents of Region 5 start practicing.
As it relates to curfews, travel restrictions, and sanitization methods, we are not imposing strict curfews and travel restrictions. However, we encourage the following. Citizens are asked to stop non-essential contact with each other. Do not congregate in public spaces such as rum shops and bars. Where possible, we ask that non-essential businesses remain closed. Supermarkets and pharmacies are asked to operate from 8 a.m. to 6 p.m. Religious organizations are asked, where possible, to live stream services via the internet to their congregation or to contact individual members via phone. Mass gatherings such as parties are also discouraged. All non-essential travel is discouraged.
With regards to traveling in public transportation and conduct at work, Dr. Nicholson also advised,
if you must travel, ensure you maintain sufficient physical distance between yourself and the commuter next to you. This implies that operators of public transportation should be willing to observe physical distancing guidelines. Office spaces and businesses are asked to erect sanitization areas that are easily accessible to your employees, clients, and visitors. Where possible, private businesses and other places of work should rotate employees to avoid overcrowding.
Additionally, he shared these details.
There will be weekly sanitization exercises at local markets, hospitals, and government offices in collaboration with the NDCs and other relevant authorities.
The Senior Health Visitor for Primary Health Care, Ms. Fenella Hamilton, also disclosed these details about the health centers and clinic operations.
Additional cleaning supplies were distributed to each health center and hourly sanitization is being done by staff. And washing sinks were installed at each health center, and clients will be asked to wash their hands before entering the building. Educational talks on COVID-19 is being done at clinic sessions and various government offices. These go hand in hand with our public advisory done by our mobile team in various communities. For our child health services, these are the recommendations coming out of the Maternal and Child Health Department, Ministry of Public Health. Only children requiring vaccines will be seen at clinics and given appointments. Children who are not ill should stay at home. For safe motherhood services, antenatal mothers within their first and second trimester will be given 7 to 9 weeks appointment. High-risk clinics will continue as scheduled monthly.
The Ministry of Public Health is calling on all citizens to heed to the health advisories and observe the correct hygiene measures and precautions. Citizens are also being asked to practice social distancing in the workplace, public places, and while using public transportation to reduce the spread of the novel coronavirus. Narima Ali, Channel 8 News.